Mesothelioma is an aggressive form of cancer that develops from the mesothelium, the protective lining that covers many of the internal organs in the body. The most common type of mesothelioma is pleural mesothelioma, which develops in the lining of the lungs. Currently, the only definitive way to diagnose mesothelioma is through a biopsy and microscopic examination of the tumor tissue. However, researchers are actively investigating potential blood-based or imaging biomarkers that may help aid in the diagnosis, prognostication, and monitoring of mesothelioma. Here are some of the key biomarkers currently being researched. Soluble mesothelin-related peptides, SMRP. SMRP is a mutated protein fragment that is shed by mesothelioma tumor cells into the bloodstream. Elevated SMRP levels in blood have been shown to correlate with tumor burden and prognosis in mesothelioma patients. SMRP is one of the most widely studied biomarkers for mesothelioma and is FDA-approved for monitoring treatment response and recurrence. However, SMRP is not entirely specific to mesothelioma, as elevated levels can also be seen in some other cancer types. Researchers continue to evaluate SMRP along with other biomarkers for improved detection and prognostic value. Osteopontin, OPN. OPN is a glycoprotein that promotes inflammation, cell survival, metastasis, and angiogenesis. It is overexpressed by mesothelioma tumor cells and sheds into bodily fluids. Elevated levels of OPN have been found in the blood, plasma, and pleural effusions of mesothelioma patients. Higher OPN expression also correlates with advanced disease stage and poorer survival. Ongoing studies aim to further validate OPN's potential as a prognostic or predictive biomarker. MicroRNAs, mRNAs. mRNAs are small non-coding RNA molecules that regulate gene expression. Unique mRNA expression profiles or signatures have been identified in mesothelioma tumors and biofluids that can help differentiate mesothelioma from other malignancies. Specific mRNAs such as miR103-3P, miR625-3P, and the miR16 family members have shown promise as serum or plasma biomarkers for detecting mesothelioma. Researchers are working to validate mRNA signatures for screening, diagnosis, and predicting treatment response. Circulating tumor cells, CTCs. As with other cancers, CTCs shed from the primary mesothelioma tumor into the bloodstream and may aid in the metastatic spread of disease. Emerging evidence suggests quantifying and characterizing CTCs through assays like the cell search system could serve as a liquid biopsy for monitoring disease progression or treatment response in mesothelioma. Studies are exploring the prognostic relevance of CTC counts and phenotypes in mesothelioma patients. Growth factors. Several growth factors involved in tumor growth and angiogenesis have demonstrated potential as mesothelioma biomarkers. For example, elevated levels of vascular endothelial growth factor, VEGF, basic fibroblast growth factor, BFGF, platelet-derived growth factor, PDGF, and epidermal growth factor, EGF, have been found in patient biofluids and associate with worse prognosis. Larger studies are still needed, but growth factors show promise either alone or in combination with other biomarkers. Imaging biomarkers. Novel imaging techniques may provide non-invasive biomarkers to detect early-stage mesothelioma or monitor tumors. Positron emission tomography, PET, using radiotracers like 18F-fluorodeoxyglucose, FDG, can identify metabolically active tumors. Diffusion-weighted MRI assessing water diffusion in tissue shows early promise as well. Quantitative image analysis extracting parameters like tumor volume, shape, or texture also show potential as prognostic imaging biomarkers. Gene expression profiling. The molecular profile of mesothelioma tumors can offer insights into prognosis and guide targeted therapies. For example, high mRNA or protein expression of MAP or BIAC pathway members associates with poorer outcomes. Researchers are defining robust molecular signatures from tumor samples that may predict survival or serve as markers for stratifying treatment strategies. This includes investigating cell-free circulating MNAs as liquid biopsy biomarkers. Many of these biomarkers are still under preclinical or early clinical investigation. Validation in large prospective studies is still needed before biomarkers can reliably supplement or someday potentially replace tissue biopsy for mesothelioma diagnosis and management. Combining biomarker panels rather than single markers may also improve diagnostic accuracy and prognostic value. With further research, biofluid biomarkers could enable non-invasive detection of early-stage mesothelioma and long-term monitoring of patients for recurrence or metastasis.